People could start getting updated COVID booster shots from Moderna and Pfizer as early as today. The CDC authorized them on Thursday. The new vaccines specifically target Omicron variants. Newsy Science and Health correspondent Lindsay Thies explains who health experts are saying should get these boosters and when.
The CDC has weighed in on updated Omicron COVID vaccines. Now, much of their role is in the small details, things like vaccination labels or the colors on the caps of the vaccines. That's so providers don't get easily confused when giving us shots. So one example you may have noticed, if you take a look at any of the video up until now from those Pfizer vials kind of coming off the manufacturing line, they had purple caps. The new ones have gray caps. This emergency authorized formula change targets the highly contagious Omicron BA4 and BA5 variants. Now, CDC data shows that about 90% of the COVID cases in the U.S. right now are BA5. Anyone at least 2 months past their last COVID-19 shot is eligible. For Moderna, it is authorized for those 18 and older. For Pfizer and BioNTech, it's 12 and up. Now, this is, of course, once the CDC director signs off on it, you're talking about shots into arms. Health experts say this is going to be more of what we are seeing from year to year, where it's going to resemble more of that flu shot to get ahead of some sort of seasonal thing as people head more inside as the weather gets colder.
The recommendations are each year that we get a flu shot, but what's in that flu shot will change each year. There's an expert committee that looks at that and determines what they think the most common strain will be that's in communities. And it's not until halfway through the flu season that we know how good that vaccine is. We're in a similar situation here with this COVID booster.
This comes, though, as federal funding for buying and sending out the vaccines is running dry. The Department of Health and Human Services says that over the next 6 months, they're going to be accelerating a transition to the commercialization of this, basically where Americans will need to pay for their COVID vaccinations themselves. The federal government says that they have about 170 million doses to distribute. That's before January 2023, when the switch is supposed to happen. So, meantime, if you want to get a COVID booster, if you don't want to pay for it, health experts say you should start looking to make an appointment for that sooner than later. Lindsay Thies, Newsy, San Francisco.
Now, the CDC says as of last week, almost 9 of 10 new COVID infections were the BA5 Omicron variant.